Before the imaging begins, explain the full nature of the exam to the patient and remove any radiopaque artifacts. Ask if he has any questions and obtain a clear verbal consent before proceeding. For an AP ankle, the patient is seated or lying supine on the table with the leg fully extended. Again, the tube is positioned at a standard 40-inch SID. The central ray is perpendicular to the image receptor with no angulation and is directed midway between the medial and lateral malleoli. Position the patient with a fully extended leg down the long axis of the image receptor. Ensure the ankle is completely bare by removing all clothing and jewelry from the area. Dorsiflex the foot and let the digits point up. Center midway between the medial and lateral malleoli. Open the collimation to include the distal tibia and fibula, ankle joint, and the base of the metatarsals. Place your marker laterally, show the gonads, and make the exposure. A diagnostic AP ankle must show an open medial mortise joint, while the lateral mortise will demonstrate natural superimposition of the fibula and tibia. For the mortise procedure, the source to image distance remains 40 inches. The central ray is perpendicular to the image receptor with no angulation. Instruct the patient to rotate their extended leg from the hip at about 15 to 20 degree angle. The goal is to place the intermalleolar line parallel to the image receptor. This specific rotation opens up all three sides of the ankle joint. Center and collimate similar to an AP ankle procedure. Place your marker, show the gonads, and make an exposure. A correct mortise oblique radiograph will display the entire ankle mortise joint open. The medial, superior, and lateral joint spaces around the talus will be free of superimposition. Lastly, for a medial-lateral ankle, the X-ray tube remains at a 40-inch source to image distance. The central ray is perpendicular to the image receptor and centered at the medial malleolus of the patient. Instruct the patient to lie on the affected side and flex the foot to a 90-degree angle. Both medial and lateral malleoli must be superimposed to ensure a true lateral. Center directly over the medial malleolus and collimate to include the distal tibia and fibula and the base of the fifth metatarsal. A diagnostic lateral must demonstrate the distal fibula superimposing the posterior half of the tibia, an open tibiotalar joint, and include the base of the fifth metatarsal.